So I have a lot of clients that will come in and talk to me. They've been in their mid-20s, maybe early 30s, and I guess I can relate to them. Every young lad wanted to be like Arnold Schwarzenegger and get big, and I have a lot of clients that will buy stuff off the internet. And yes, they get to be a pretty fit human, but they don't realize there's some downward side effects of supplementing without monitoring laboratory work. There's a couple components here that can be quite interesting that I've come across a couple times. One is some of this testosterone will balance out with estrogens, and if you don't appropriately control the estrogen levels, then you can have some unwanted side effects. If it goes too high, you can get breast tenderness, nipple tenderness, irritability, mood swings. If it goes too low, then you can have erectile dysfunction. I had a client a couple months ago that he came in with an estrogen of 120. Ideally, I like to keep this under 40. And so he broke out in tears in our encounter with each other, because I said, hey, you've been supplementing with synthetic testosterone over the internet for so many years that your estrogen levels have risen and it's making you have these mood swings. And he turned to me and says, that's the worst news I've ever heard. I said, that's okay, we can correct it. This is one reason why we monitor it. Another reason why we monitor is testosterone can increase red blood cell production. If it goes too high, it can make you feel groggy, lethargic. It also puts pressures in spots of your body that doesn't need all that pressure. More blood does not essentially mean better. Simple solution to that is to monitor it. Some guys have to get rid of blood more frequently. What that looks like is either going down to American Cross or Blood Connection to donate blood. If unable to do so, then we just have you with our phlebotomist. And we do a therapeutic phlebotomy, which takes about 20 minutes. These are all things we got to monitor when taking testosterone supplements, especially at these younger ages where we don't have the complete knowledge base and we're just trusting the internet. Another thing we got to watch out for is prostate antigens with testosterone therapy. If you are an older client, typically we don't see this in younger client, you're at increased risk for prostate cancer. Now, if taking testosterone, that can kind of make the prostate cancer grow faster. Testosterone is not completely contraindicated in prostate cancer. Johns Hopkins University actually has some testosterone therapies to battle prostate cancer, but this is something that we got to be conscientious of and be diligent with so we don't harm ourselves trying to seek the benefits of testosterone, but not controlling the unwanted adverse reactions.